Hey everybody, this is Dr. Osborne with glutenfreesociety.org, and today I've got a research update for you. The question is, can blood pressure medicine cause celiac disease? Well, research is mounting on this one, and the fact of the matter is the answer is yes. Let's look at some of what many research studies have to say. In this particular study published in the journal Gut, you can see the conclusion is that olmesartan, which is a type of blood pressure medication, it's actually considered to be an angiotensin II receptor blocker type of medication. So if you're taking this, it generally goes by the name of olmesartan. It's associated with an increased risk of hospitalization for intestinal malabsorption and celiac disease. But that's not all. We've got other studies. Again, angiotensin II receptor blockers linked to intestinal damage that mimic celiac disease. This study, published recently from the Annals of Gastroenterology, states that patients who developed chronic severe non-bloody diarrhea, weight loss, and muscle wasting after prolonged use of olmesartan. So in essence, if you are somebody who's been put on a blood pressure medication, particularly this class of medication, these angiotensin II receptor blockers, aka olmesartan or telmisartan, and you're developing unexplainable weight loss and gastrointestinal dysfunctions, it's very important that you get in and talk to your doctor right away about the potential for this drug creating an actual celiac disease or mimicking celiac disease. Here's another research study published in the World Journal of Gastroenterology. These findings suggest that olmesartan was a contributing factor in the etiology of this patient's celiac sprue or celiac disease. Clinicians should be aware of the possibility of drug-induced celiac sprue, aka celiac disease, and potential reversibility after discontinuation of the medication. Now, here's another study, blood pressure medication on duodenal villus atrophy. It's just a fancy way to say the upper part of the small intestine was damaged. The villi were flattened as a result of using olmesartan. Again, this angiotensin II receptor antagonist medication was being used to treat high blood pressure, and in this case study, it created this person to develop a severe sprue-like gastroduodenal problem, as well as an acute kidney injury. So not just limited to the GI tract, but in this case also acute kidney injury. Again, in this gentleman taking this medication for a period of several years, in this case 3 to 4 years. Now, physicians should consider medications as potential causes for intestinal disease or intestinal inflammatory damage, and that's what these authors of this study, published in the Canadian Journal of Gastroenterology and Hepatology, came to the conclusion of. In this next study, you see here blood pressure medicines, acute gastrointestinal bleeding. Again, the same medication keeps popping up, this olmesartan, right? Collagenous gastroenteritis is a rare disease that is known to be associated with the drug olmesartan, an angiotensin II receptor antagonist used to treat hypertension, aka high blood pressure. So again, a lot of repeat here, but wanting to show you the research. In this particular study, published in Digestive and Liver Disease, an International Journal of Gastroenterology and Hepatology, the symptoms of the use of olmesartan actually created diarrhea and weight loss without the intestinal inflammation. So in essence, these particular patients did not have, on their biopsies, they did not have the villus atrophy generally associated with celiac disease. And what these authors conclude is that if you're on these medications, you develop diarrhea, muscle loss, weight loss. Don't wait for the damage to be so significant and so severe that it shows up on a biopsy. Get with your doctor right away and pick a different medication or create a different plan of action. In this Mayo Clinic study, you can see here that histologic recovery and improvement of the duodenum, that's just a fancy way of saying that the cells in the small intestine looked better under a microscope. In other words, the damage that was there under a microscope actually improved and healed when the medication was discontinued. And this study was done on 18 patients who had follow-up biopsies. In essence, the conclusion here is olmesartan may be associated with a severe form of sprue-like enteropathy, clinical response, and histological recovery. are expected after suspension of the medication. So I say all that in all of these studies simply to say this: if you are taking an angiotensin II receptor antagonist or blocker, and you have developed severe gastrointestinal inflammation, diarrhea, unexplainable weight loss, you may have drug-induced celiac disease. Now, the reason that's important to know is because some people get put on a gluten-free diet and don't respond. And if you're one of them and you're taking this class of medication, it's very, very important that you get with your doctor. And here's why. There's a condition called refractory celiac disease. This is when somebody has been identified with celiac disease. As I've shown you, this medication can cause celiac disease. And in refractory celiac disease, they go on a gluten-free diet, they don't get better. And then the next step usually is steroids. Now, in the next video, I'm going to show you how steroids can actually cause a celiac-like damage to the small intestines as well. So you'll want to stick around for part 2. But my point is, in refractory celiac disease, if you're not responding, doctors oftentimes want to put you on a steroid when you fail to respond. So again, if you're not responding but you're taking olmesartan or an angio 2 receptor antagonist, you need to get with your doc about a different type of medicine or about diet and lifestyle change for high blood pressure, because the fact of the matter is high blood pressure can be greatly affected by weight loss and by diet and lifestyle change. So if you haven't had that conversation already with your doc, it's long overdue, especially if you're starting to develop this problem. So hope this is research update and alert is helpful for you. We'll see you in the next research update. This is Dr. Osborne. Have a great day.